Kia ora. Before I begin, just a quick comment on the weather and the effects of weather warnings that we're seeing on the West Coast. You will have seen that there are parts of the West Coast that are currently being evacuated by teams over the course of the day. We are at the moment expecting that the weather down there is likely to mirror a similar event in 2012. We are closely monitoring the situation. The New Zealand Defence Force are already en route with the capabilities that you'd usually expect in these circumstances to provide additional support to our National Emergency Management team on the ground. Happy to take questions. And of course, it has become a practice for us every year to be on the grounds at Waitangi in order to mark Waitangi Day. But that doesn't stop us from around the country being able to take stock on the day, to reflect, as I've done today with our national iwi chairs in a forum, on the progress that we're making and the work that's yet to be done. And so no matter where we are in the country, we can continue on with that. There's always more work to be done, but in my view, that will be the case with a document that is a living document, where we're constantly striving to be better partners as government. But we've made enormous progress over even the past year, but it is about looking forward as well.
Yeah, with the border plan, are you concerned that we might lose workers such as nurses?
Well, of course, we've equally seen workers coming in. New Zealand is in demand, and we've made special provision to ensure that critical workers are eligible in the early stages of the reopening to make sure that we continue to have that flow of workers that New Zealand really needs coming in as well.
What did they tell you about the pandemic? There also they said there was not consultation about border reopening announcement and Maori being addressed by government.
I'll make a general statement and then I'll give an opportunity for Māori ministers to make a comment as well. Throughout, I'll just do that if I may. Throughout the pandemic, we've worked really closely with Māori on our response, and there's been areas in which, particularly things like care in our community, we were ensuring that we are able to look after people increasingly as it becomes a mild to moderate illness in their homes. We've also been working closely on our vaccination rollout, and everything that we're learning and developing along the way, we're using to improve and ensure that every stage is better than the last. We know that there's always more that we could be doing, but I'm confident that what we've done here in New Zealand has protected all our people, including Māori. On the reopening dates, we've been very deliberate in choosing to reopen at the time that we have to enable as many people as possible to be eligible for their booster. In fact, 92% by the time we reopen will be eligible for that booster, and I encourage everyone to go out and take up that opportunity. Minister Davis?
Just in the comment about people don't think that there's been enough consultation, I just disagree entirely with that. We've been engaging with Māori since probably March of 2020. In fact, earlier this week we met with the pandemic response group. We gave them a heads up about the Prime Minister's announcement that she made yesterday. They were fairly relaxed about that. Appreciated the conversations that we have been having. So I just really dispute the calls from some groups in Māoridom that there hasn't been consultation, because even this week I think we've met with Māori, the iwi chairs 3 times. During the height of Delta last year, I was meeting with 3 groups, different groups each week. So there's been a lot of conversations and we've taken on board a lot of the ideas that they've come up with.
Not necessarily, but go ahead with your question.
Are you concerned by that stage that the immunity on boosters for a lot of people will have effectively off?
At this stage, I think what every New Zealander has seen is that 4 weeks is a long time in a pandemic, let alone many months. Yesterday what we announced is the later stages that we foresee our reopening plan, firm dates for Kiwis returning, but then in those latter months where you see us talking about the return of tourists, we actually expect those dates are likely to come forward. So that is enabling people to plan, but we've also given a very clear signal that there's a good chance the dates will move. You would have heard earlier this week Dr. Ian Town, who's the lead on our clinical advisory team on vaccinations, referring to the fact that there's not yet clinical data submitted from pharmaceutical companies, the likes of Pfizer, around the need for a fourth shot. For premature for us to be commenting on that at this stage. It is early stages. It's not yet, as far as I can see from what we're hearing our experts say, conclusive as to what waning effects we're seeing. Look, what was really important for us is that we're in a position now where vaccinations are widely available for children and for parents to make that decision, that informed decision themselves. It is really a call for parents and caregivers around the decision to have their children vaccinated. We wanted that to be available before school starts, so they do have the ability to ensure their kids are fully are given that protection before they go back to school. But a big focus for us right now is boosters. We know, for instance, that boosters do enhance the protection against hospitalisation and severe illness and death, more so than just 2 doses. So I encourage everyone, many became eligible today, please go and get your booster. You have a chance to do it before Omicron is widespread.
There were not huge queues here today. And
just opened, to be fair to them.
Around Auckland, they're not queuing out the doors. Are you at all concerned? This is supposed to be a big day for the booster.
Oh, look, we announced on Wednesday the extension. So 48 hours later, the ability has now kicked off. We expect, of course, over time to see that urgency or at least that demand increase because, of course, hundreds of thousands of people became eligible just today. So we'll monitor how we're tracking. We'll do everything we can to continue to encourage it. But to individuals, I say again, this is the best protection we can provide. The stats are telling us you will be safer with a booster.
Novavax got provisional
Yeah.
today. Are you expecting this to give the whole booster thing a boost, or and when do you think it will come?
So Novavax is being approved by MedSafe now. It's got an extra stage to go through, and that's the Director General to make recommendations to us as ministers around its use. My understanding is that that was approval for primary doses. So approval for dose 1 and 2. So one final stage, but we'll move very quickly on that. And it adds then to the suite of vaccines that we have available to us in New Zealand. Sorry, what was that? No, those dates are set. We have wider eligibility now. 92% of New Zealanders who have been vaccinated will be eligible to then be boosted, and we're encouraging everyone to take up that chance. Yeah, so at the moment you'll know that our vaccine passes take us through till June. We have not as yet added a booster requirement to vaccine passes. It is something that we're in discussions with the Ministry of Health team over, but no final decisions on that have been made. But regardless, I do encourage people to go out and get their booster. We have been talking with the Ministry of Health. They said earlier this week that there are plans to run campaigns alongside the booster program to encourage uptake and to create the same energy we saw out of Super Saturdays. So I'll leave them to release a few more details in the future on that. Oh, yeah, sure. Look, the criteria for us moving out of red is quite straightforward. We want to know that we are managing COVID within New Zealand in such a way that it's not placing extra pressure on our health system, that we're not seeing severe impacts on our vulnerable communities. So we constantly monitor that. We're right at the beginning of an Omicron outbreak though, so obviously red is the best place for us, but in the future we'll keep looking at how the health system is managing in order to see if we can move.
Yeah, just on that though, our cases, to be fair, so far have actually remained pretty consistent
system around that 100 mile. The others are actually keeping up, but we're not seeing the thousands and thousands which were predicted. So that's obviously going to be a good start.
Yes, I think, taken as a whole, there's a range of factors that I think are making a difference to New Zealand's experience of Omicron versus other countries, and that's a sign of success. We went early with our public health measures. We've got good vaccine uptake, and that's vaccine uptake that's been recent, so that may well be helping. And of course, we continue to see booster uptake. So that is helping. But we're very clear, it's likely to spread. It is slow the spread. It will not stop the spread of Omicron. So we still want people to get boosted.
Frank Blakey this morning said effectively, let it go quickly so that it leads quicker.
I don't know that Tony would necessarily characterise his comments necessarily in that way because, look, I think all of our experts would agree that the strategy has to ensure that we don't have an overwhelmed health system. So everything we're doing at the moment is about slowing it down so that we can manage the outbreak that we have in a way that doesn't impact your ability to get what other medical care you might need. What we're not yet clear on from international evidence is if you do slow it down, does your experience of Omicron take the same amount of time or does it prolong it? Jury's a bit out because not too many countries have managed to slow it down. But again, we'll continue to make decisions that are about ensuring New Zealanders get the health care they need when they need it.
National says the government isn't building enough social housing. What's the response?
Well, of course, one of the main priorities of this government has been when we came into office and were facing a housing crisis where the last national government had continuously sold off our state housing, was to rebuild our public housing stock. And we've done that at an incredible rate, rates we haven't seen in decades.
Is the government timing the border reopening and stuff like that so that we have cases peak before winter?
We are keeping in mind the impact that winter may have on our ability within our health services to provide everyone with the care that they need. Our reopening has been based on several factors, the most important being the level of protection we all individually have. So knowing that as many people as possible will have the chance to be boosted has been a big part of the decision making. But also this time of year does have some added benefit in terms of public health measures because it is more likely that people are outside, easier to social distance, better ventilation, and all of that does help with management.
The requirement for attorneys to self-isolate.
Yep.
How long do you envisage that will remain in place? Will it be the rest of this year at least? What are your...
Look, I would not anticipate that. You see, even Omicron has only, for instance, been with us as a variant of concern, according to the World Health Organization, since the end of November. You can see how dramatically things have changed in that time. We've already said we anticipate the isolation period for contacts as we move through the management of Omicron to reduce down in time to 7 days. So we do expect things to change and to change quite quickly, but we will take it on the advice of our public health experts, but we'll keep it under constant review.
What would you say to people who are concerned that may put off visitors to business trips and self-isolation?
Well, of course, one of the things we want to do is make sure that we manage the pandemic in a way that New Zealand continues to be, as it is already now, a very attractive place to come because of our management of COVID-19. So we want to make sure that New Zealanders who are here have the least impact on their daily lives as possible, and that will help us attract others to come in as well. So it's a constant balance, but one I think we've got right.
70% of eligible now have been boosted.
And then I'll come and finish with you if I may.
Do you think there's any more hesitancy when it comes to the booster as opposed to the second shot of the Pfizer vaccine? Like, what are you hearing? If you had friends, for example, say to you, I'm just going to wait for the booster.
But wait for the booster for...
I'm just going to wait it out a little bit.
Okay, before they get it. Yeah. Look, we've been talking to our teams on the ground around what they're seeing, what they're hearing, what they're picking up around boosters and uptake. We want our booster rate to be as high as possible, and that's because, quite simply, it stops people getting severely unwell. So at this stage, it is a bit anecdotal as to why perhaps we haven't seen the high rates of demand. What I have observed is that in other countries, when Omicron spread at a faster rate, people were quicker on the uptake with their booster. I would urge people, don't wait. Once Omicron really takes off, there isn't that same period of time to get the full benefit of your vaccine. So please, don't delay. Get it today. One final thing I'd quickly add. You'd heard Dr. Bloomfield at the beginning of the week mentioned the side effects that people experience with vaccines, which we all have come to expect, a sign that the vaccine's doing what it should. He did note that they appear to be of a lesser degree for the booster than, for instance, say the second. So if that's cause for anyone's hesitancy, I thought it was a notable observation from our Director General of Health.
Minister Hipkins said this morning businesses will determine themselves whether they're a critical workforce and need RATs. Won't that lead to chaos?
No, not at all. We've had a number of systems all the way through our COVID health management that have relied on businesses, once we set out some guidance, relied on them then determining whether or not they fit that criteria. It's been part of the partnership approach that we've taken, and is part of our approach going forward of supporting businesses to look after the health of their workforces, and that's what this is all about. Okay? Last one.
Isolate vulnerable whānau. Would you might you still be there for you or if you're travelling to New Zealand and can't self-isolate from vulnerable whānau again?
Yeah, look, there is of course, in the future we anticipate or have to prepare for a larger number of cases. So that means there won't be necessarily the same capacity to provide accommodation that we have in the past. For any incoming travellers who may have that concern, I would encourage them to work through their options if they are worried about self-isolating with other whānau. But for the most part, of course, many are likely to return to their home. Okay, thanks everyone. A better call time. Oh,
Just one question.
yeah, sure.
Thank you.
And then we'll wrap if we may. Yeah. Better get on to the next one.
So there's people in Auckland that we might hear who are reporting that infected themselves with COVID to get out of their life faster. So what would you say to them? Do you see that as more?
It'll have the opposite effect of what they think it's going to have.
That's a really bad idea.
Extra 10 days of
It's a bad approach, and I'd encourage people not to do it.